Hello friends, today we are going to learn about pre-anesthetic medication. Let us know the definition of pre-anesthetic medication. It is nothing but the use of the drugs before the anesthesia is given to the patient to make it safe and less unpleasant. When we give any medication to the patient, they must have some aims and objectives. So let us know what are the aims and objectives of pre-anesthetic medication. So aims and objectives of pre-anesthetic medication are mainly 5. So let us start with the first one. The first of all is to relieve the patient of anxiety and apprehension before the surgery and also to produce amnesia during the surgery. The second one is to supplement the analgesic effect of the anesthetic given. The third one is to decrease the secretions and vagal stimulation that is caused by the anesthetic. Fourth one is the anti-emetic property, and the fifth one is to decrease the acidity and volume of the gastric juice produced. Let us start with the first one. Let us see about the drugs that relieve the patient of anxiety and apprehension and that produce amnesia. Benzodiazepines are the most popular anti-anxiety drugs used. Of the benzodiazepines, diazepam and lorazepam are the most popular pre-anesthetic drugs. They are most popular because of their ability to produce tranquility, and they also smoothen the induction of the anesthetic given. Besides, they also produce very little respiratory depression and vomiting post-operatively. When diazepam and lorazepam are given to the patient, they leads to loss of recall of all the perioperative events, and thus they are the best drugs that can be given. Diazepam and lorazepam are often used along with fentanyl in many surgeries and endoscopic procedures. Now coming to midazolam, it's another benzodiazepine which has good amnesic properties. And the third drug in this category is promethazine. It is not any benzodiazepine, instead it is an antihistaminic. It is an antihistaminic with various other properties like the sedative property, antiemetic property and anticholinergic property. Now coming to the second one, that means supplementation of the analgesic effect. The main component of the anesthesia or the general anesthesia is to produce analgesia. So the anesthetic that is given to the patient must produce analgesia also. Let us see what are the analgesics that are given pre-anesthetically. Opioid analgesics are the most popular pre-anesthetic medication that are used previously to produce analgesia. Opioids like morphine and pethidine are used previously. They produce pre- and post-operative analgesia. They reduce the dose of anesthetic required to produce anesthesia as they are also producing analgesia. They reduce the post-operative restlessness. But besides these effects, these have many disadvantages like respiratory depression. They cause fall in BP during the anesthesia or during the period of surgery. They can precipitate an effect of asthma. They delay the recovery of the patient. They delay the gastric emptying. They can cause biliary spasm. And due to delay of the gastric emptying, the patient can suffer from constipation. Hence, due to all these disadvantages, the use of the opioid analgesics is now restricted to only the patients with post-operative pain. But when strongly indicated, only fentanyl is injected IV before the induction of anesthesia. The third objective is to decrease the secretions and vagal stimulation. The drugs that are used to decrease the secretions and decrease the vagal stimulation are atropine, hyoscine, and glycopyrrolate. All of these are anticholinergic drugs, most appropriately antimuscarinic drugs. So what is the need to decrease the secretions during the surgery? When the secretions are produced during the surgery, they can cause aspiration pneumonia. To prevent these secretions, aspiration into the bronchi or trachea, these drugs are used to decrease the secretions. So these drugs decrease the salivary and bronchial secretions. They also mainly prevent the vagal bradycardia and the hypotension that is produced during the surgery. They also show prophylactic effect on the laryngospasm. Apart from that, hyoscine especially also has amnesia, antiemetic effect, and it may cause delirium. Glycopyrrolate, it's the most preferred drug to decrease the secretions and vagal stimulation because it has less CNS effects, It has high anti-secretory action and it also has low tachycardiac effect. These all drugs also facilitate the artificial ventilation and decrease the airway resistance, but all these drugs cannot be used in the febrile patients. The fourth property is the antiemetic property. The anesthetics when given generally produced nausea and vomiting after the surgery or the anesthesia is withdrawn. So let us see what are the drugs that has antiemetic effect. The first drug is metoclopramide. It is usually given preoperatively to reduce the post-operative vomiting. It reduces the gastric reflux and aspiration. It enhances the gastric emptying and increases the tone of the lower esophageal sphincter that it remains closed and hence prevents the gastric reflux and aspiration. It causes extrapyramidal side effects besides the antiemetic property. Therefore, it is less common use nowadays. In combination with H2 blockers, it is more effective in producing its effects. The next drug is domperidone. It has same effects as metoclopramide, but it does not have any extrapyramidal side effects. The third drug is ondansetron. It is a selective 5-hydroxytryptamine receptor blocker or the serotonin receptor blocker. It is highly efficient in its antiemetic effect and it has no side effects. So this is the most preferred drugs or the antiemetic drug that is used pre-anesthetically nowadays. The fifth category is to decrease the acidity and volume of the gastric juice. To decrease these effects, ranitidine or famotidine or omeprazole or pantoprazole are the most common drugs that are used. These are given the night before and morning before the operation. They increase the pH of the gastric juice. Besides, they block the H2 receptors or the histamine receptors and they decrease the HCl production in the stomach so that the volume of the gastric juice is decreased. When the volume of the gastric juice is decreased, there will be lesser chances of producing the gastric aspiration and aspiration pneumonia and stress ulcers during the surgery. That's it for this one, guys. Thank you.